For millions of people across England, NHS dentistry has now effectively ceased to exist.
2 years ago, I raised the case of a Norwich Army veteran. In such agony, he was forced to pull out 18 of his own teeth because he couldn't get access to a dentist.
Shocking findings by the British Dental Association has found 13 million people, well over 1 in 4 adults, are now struggling to access dental care. Just think about that. 13 million.
It's an experience that's been felt across the country. In Bristol on Monday, there was scenes of a line forming all the way around the building for people desperate to get an NHS appointment in a practice that had opened. And within 2 hours of opening, police had to be called to control the line.
People are now forced to pull out their own teeth with pliers. It's not Victorian, it's medieval. And many are driving hundreds of miles for treatment. And that's if they can find a dentist at all.
It's a major crisis, but there's been long enough that crisis has been known about for it to never get to this stage.
I've been looking since I got dumped by my old dentist, and I haven't been able to find anyone that's not private.
We get a lot of people in the pharmacy queues. What's the best thing for toothache? I can't get a dental appointment, over and over and over again.
And now this.
The dental crisis has turned a dark corner.
Their website was quite a believable website.
With NHS appointments getting harder and harder to find, unscrupulous scammers are targeting people desperate for treatment.
Criminals are now seeing an opportunity, targeting millions of desperate people with no option. The situation is shocking, and it's now looking worse than ever. The government's own data shows a staggering 97% of new patients who try to get an NHS appointment fail to get one. 97%. For new patients, NHS dentistry has effectively ceased to exist. More than 100,000 children have actually been hospitalised since 2018 for rotting teeth. Just think about that.
In Wolverhampton, they have the highest rate of tooth decay in children in the country, and someone who's seen the worst of it is Neil Barcher. You've been working here in the area for 16 years.
That's right. The situation is that we've got an unworkable dental contract which actually penalises dentists for spending more time with clients and patients, and as a result what we've got in Wolverhampton is some of the largest amounts of dental tooth decay, and I've seen it firsthand, and it's horrible to see. And what we have now is a situation where those in most need of dental care, those poor children, are actually the least likely to receive it.
It's absolutely shocking. Tooth decay remains the #1 reason for hospital admissions among young children. And research by the British Medical Journal has shown children in our most deprived communities are now 3 times more likely to need their teeth removed. This is a wholly preventable disease. But decay and deprivation go hand in hand.
There is total desperation, and despite the promises of new appointments from the Labour government pre-election, there wasn't much detail in the budget of how that was going to happen, was there?
In fact, the autumn budget has seen dentists alongside GPs, care homes and hospices hit with new costs that could shut some down and actually make this desperate situation even worse. And there was no new funding to fix this crisis. The new government pledged to rebuild dentistry for the long term.
They've inherited a huge problem from the last lot, but you want to see the plan for how you're going to quickly start to address it, because it does become your problem. You have inherited, you can blame them for that, for the problem, but it's your responsibility in government. How are you going to resolve it and make it better?
Well, that's a good question. Already, instead of promised new investment to deliver manifesto pledges on urgent care, what we've seen is suggestions of a shift to recycle existing budgets. The British Dental Association is calling on the government to offer a rescue plan to keep struggling practices in the NHS and show there's at least light at the end of the tunnel. And rapid action is needed. Labour pledged in their manifesto to reform the discredited contract dentists work to, a system that's fueled an exodus from the NHS workforce. So the new government must now move at pace and with urgency if NHS dentistry is going to have a future. The government needs to set a timeline and commit the necessary funding. It's the only way to save NHS dentistry.